Although there are many benefits to nursing care when you incorporate transcultural influences, it is undeniable that this also brings its own challenges. It is important to explore and develop your understanding of transcultural nursing so that you may improve your holistic nursing care. This presentation highlights the importance of transcultural nursing and cultural care in a healthcare setting, with supporting evidence from Madeline Leininger's theory. The factors influencing transcultural nursing, including the nurse's individual background, geographic and ethnographic considerations, and religion. The role of professional regulation and registration from the perspective of the new nurse. How we need to be aware of our own biases and the standards we must practice by. The impact of healthcare-related policy on contemporary nursing practice, and how our practice benefits from following policy and best practice procedure in relation to cultural sensitivity. In today's environment, where international travel and new innovations in healthcare are frequently advancing, the preferred model of nursing has changed drastically from that of previous centuries. One's ability to embrace and recognise diversity in cultures is vital, especially in the nurse's scope of practice and care. In past years, nursing education had merely skirted around the importance of understanding and differentiating between diverse cultures, even though they would undoubtedly meet and care for people from very different backgrounds. This left nurses at a disadvantage because they were unfamiliar with the needs and expectations of patients from different cultures. The transcultural theory of nursing, or culture care theory, as proposed by Madeline Leininger, is a well-founded nursing theory, emphasizing culture and care as being essential concepts in nursing practice. It is commonly misunderstood and greatly underutilized. Nurses are highly capable of being advocates for patients' cultural needs, and as a result, it is very important that we recognize the benefits of transcultural theory of nursing. There are many factors restricting us from achieving cultural competence, which we will discuss in the following slides.
Cultural competence not only involves the nurse's relationship with the patient, but also the nurse's relationship with their environment and societal structures. Each nurse brings their own knowledge, personal and professional experiences to the patient-nurse relationship. Patients also bring similar aspects to this relationship, creating a safe space for dialogue and awareness of preconceptions and differences in culture in the relationship. The nurse's actions are based on critical thinking and reciprocity from the patient. The nurse's goal is to understand the patient's own unique experiences and to recognize a pattern that can then guide the nurse's actions to cultural safety. There are three main factors influencing transcultural nursing. The first factor is the culture of the individual or patient. When nurses understand the specific factors affecting individual health behaviours, they will have more success in meeting their individual needs. Individual beliefs about health differ from culture to culture. These beliefs and past experiences play an integral role in improving the health of individuals. Culture is influential in how people think, speak, dress, believe, eat, and approach illness and death. Moreover, it plays a significant role in a variety of aspects such as new diagnostic methods, prognosis, symptomatic patterns, and determination of whether there is a health crisis or not. The second factor influencing transcultural nursing is the cultural background of the nurse themselves. The nurse's own customs and traditions, beliefs and values are also important in transcultural relationships. The nurse's self-awareness is integral and is the starting point to understand the patient's needs from a culturally diverse perspective. The third factor influencing transcultural nursing is the culture of the environment. The environment is an integral part of the culture. Individuals as physical, ecological, socio-political, and cultural beings are continuously interacting with each other. Nurses may have to intervene in the patient and the family relationships because of frequently culturally specific arrangements and procedures. The transcultural approach should be considered in day-to-day nursing and is influenced by the nurse, patient, and the environment. Most graduate nurses coming into their first years of practice may believe that they have an open mind with no judgment. However, unconscious bias, implicit bias, is more likely present and can affect the way in which we work in a transcultural environment. The unconscious bias is embedded in our minds before we can remember, and may contribute to disparities in the care between members of certain racial or religious groups. Bias can be seen through inadequate assessments, poor treatment, and rush discharges. This could be a significant factor as to why people in minority or vulnerable groups have poorer health outcomes than compared to those in a majority group. In order to stop this, we must as nurses acknowledge our bias in order to improve personal growth. If we do not stop our biases, controlling our care, then we are not actually following our guiding policies and procedures. A way to overcome this bias could be as easy as before entering a patient's room, taking a breath, understanding your thoughts, identifying assumptions you may have already made, clear them, and enter the room with an open mind.
The Nursing and Midwifery Board of Australia has 7 standards that we must adhere to in order to maintain good practice as a registered nurse. These standards guide and support us to eliminate bias within the workplace if followed correctly. For example, Standard 2 suggests that we engage in therapeutic and professional relationships. To do so, we must communicate effectively to all patients regardless of their race or culture, finding a professional translator if needed and being respectful of all cultural traditions and health views. Standard 4 identifies that we must comprehensively conduct assessments. These assessments must be carried out in a culturally appropriate manner. No stereotypical assumptions should be made by a nurse when treating someone from a specific background. An open mind will provide the most holistic form of assessment. Standard 6 provides safe, appropriate and responsive quality nursing practice. This can be done by ensuring all needs of the patient are met if possible to achieve agreed goals and outcomes. For example, for Aboriginal people, their goal may be to return to their country and have traditional healing instead of in-hospital care. The nurse team should work collaboratively to make this possible in order to achieve the patient's goals. Another form of standards that guides our practice is the National Safety and Quality Health Service. These involve clinical governance, partnering with consumers, preventing and controlling healthcare-associated infections, comprehensive care, communicating for safety, blood management, and recognising and responding to acute deterioration. If these 8 standards are followed correctly, there should be no difference between the care of different people of different backgrounds, and also all staff must abide by these standards regardless of their individual backgrounds. It is highly evident that there are many various areas that have room for improvement and change within the Australian healthcare system. Some recommendations proposed by McMurray include: it is recommended that a 5-pronged approach be implemented for effective transcultural nursing in Australia. These include valuing diversity, developing a capacity for cultural self-assessment, maintaining awareness of the dynamics inherent in the interactions between cultures, institutionalising cultural knowledge, adapting service delivery to reflect the understanding of diversity between and within cultures.
Among many Asian cultures, touching a person's head may be impolite because of their culture, believes that that's where the spirits reside. Hispanic and Arab cultures, male healthcare providers may be prohibited from touching or examining certain parts of the female body. Females may also be prohibited from caring for males. Although most nurses are taught to maintain eye contact, some cultures interpret maintained eye contact as a sign of disrespect. In conclusion, transcultural nursing is an essential concept in nursing practice. One's ability to embrace and recognise diversity in cultures is vital, especially in the nurse's scope of practice and care. Cultural competence not only involves the nurse's relationship with the patient, but also the nurse's relationship with their environment and societal structures. We must acknowledge our biases in order to improve personal growth, and if we do not stop our bias, controlling our care, then we are not actually following our guiding policies and procedures. Well done, guys.
How long was that?